Hello everyone, my name is Adele Jabe, and this is the final PowerPoint presentation for CSD 408, the case study. So just a little background information before I start. I did my placement at the Grand Rehabilitation and Nursing in Queens. There are 2 supervisors and a CF who are in charge of all speech language and dysphagia evaluations and treatment. Okay, so a little background information about my resident. So my resident is SS. She is a 52-year-old female currently residing at the Grand Rehabilitation and Nursing in Queens. She is originally from Guyana, where she owned an antique store with her husband. She is the mother of 2, and her daughter gave birth to a baby boy 5 months ago, which was key when planning intervention. Okay, so for her medical history, SS had a left middle cerebral artery CVA in May of 2016. She has hypertension, uterine fibroids, right peroneal vein deep venous thrombosis (DVT), right upper extremity weakness, and she had a seizure-like episode on September 3rd, 2017. Okay, so she developed heavy uterine bleeding, and when she was brought to the hospital in Guyana, it was discovered that she had a left MCA stroke. So she was sent to the United States for rehabilitative services, and which include physical therapy, occupational therapy, and speech therapy. And since she was sent to the United States, her husband had to close down their antique store. Okay, so she was receiving therapy at the Grand, and then she had the seizure-like episode on September 3rd, 2017, and she was sent back to the hospital. When she returned back to the Grand after the seizure-like episode, the CT of her head on 9/3/2017 revealed that there was a large area of encephalomalacia and gliosis in the left MCA territory, consistent with known chronic left MCA stroke. There was unchanged chronic right parietal cortical infarcts. There is generalized cerebral volume loss. There is extensive patchy white matter hypoattenuation, which is nonspecific in etiology, but likely relative to chronic microvascular ischemic disease. Okay, so post-stroke seizures, according to Tanaka and Ihara, there are 2 types of seizures. The first is early seizure, which occur within the first few days after stroke. And then the second is late seizure, which occurs 6 to 12 months after stroke. Cumulative seizure rate after stroke has been found to be 6.1% after 1 year, 9.5% after 5 years, and 11.5% after 10 years. So since SS had her stroke in May and then had a seizure-like episode in September, this would be considered a late seizure. So unfortunately, I did not start at the Grand yet when she came back to rehab following her seizure. But thank you to the charts and all the information, I do have the results of her speech language and cognitive bedside exam. So her auditory comprehension was moderate. Understanding yes and no questions was 50% accurate. Following 1-step commands was 50% accurate. Following 2-step commands was 25% accurate. Discriminating body parts was 25% accurate. Discriminating objects was 50% accurate. And understanding conversation and gestures was 50% accurate. S's verbal expression was severe. Making needs known was about 50% accurate. She was on a word level repetition. naming objects was 50% accurate, expressing with gestures was 50%, and picture description was 0%. When the resident was presented with the cookie deaf picture, she did not express any verbal language. So her diagnosis was aphasia, which is ICD-10 code R47.01. And her chart did not give her the specific aphasia, but after working with her and learning about the different aphasias, I would say that her aphasia is similar to Broca's non-fluent aphasia. And in the chart it also said apraxia, which is ICD-10 code R48.2. So as I was reading over the patient chart to find out the information for this case study, I did see that when she first arrived at rehab in May 2016 for the left MCA stroke, treatment was targeting both apraxia and aphasia. But since she has been at the rehab for over a year, her goals have changed, so we only work on improving the aphasia. She has improved auditory comprehension and reading skills, which is why the speech department was able to get her a personal augmentative and alternative communication system, which is an iPad. And dysphagia evaluation was not administered due to the prior level of function. She is on irregular consistency and thin liquids. Okay, so Broca's aphasia. The core features are effortful speech production, semantic and phonemic paraphasias, and a paraphasia refers to the production of unintended syllables, words, or phrases during the effort to speak. Articulatory errors, agrammaticism, which is characterized by grammatically limited utterances secondary to brain damage, specifically morphosyntactic deficits, which include omission of articles, prepositions, and possessives, and these all help connect the nouns, adjectives, and verbs in the sentences. And also, people with agrammaticism omit plurals and verb endings. And the last, another core feature of Broca's aphasia is relatively preserved comprehension, which is what SS had. Okay, so therapy. So she is seen 5 times a week for 30-minute sessions for speech, OT, and PT. And she's also seen one time a week for a 60-minute group session for speech. So as it was stated before, she did not have any trouble swallowing and is on a regular consistency in thin liquids, and she only received speech and language therapy. Okay, so for the goal. So her long-term goal, the resident will improve total communication, including speech, gestures, and the use of supplemental assistive communication devices to improve the ability to communicate simple needs with staff and family. And that is the G code for that is G9162 modifier CK. And her short-term goals are, so short-term goal 1 is resident will increase selection accuracy of personally relevant vocabulary and iPad communication system with ProLoco to-go software in 8 out of 10 trials given mild visual and verbal cues. Short-term goal 2, resident will create messages for staff and family utilizing iPad communication system in order to express medical and social needs to staff and family in 8 out of 10 trials given minimal cues and iPad setup. And then short-term goal 3, resident will increase use of gestures for a set of 10 words to facilitate word retrieval in 8 out of 10 trials given mild tactile and verbal cues. So, so the use of an AAC can increase linguistic possibilities of people with aphasia and promote changes in social interaction and social relationships, favoring a more active participation of the subjects, according to Bahia and Chun. And I agree with these goals and also the long-term goal because it is important for her to communicate to her family when they came to visit, and also since she was at the rehab, making her wants and needs known with medical staff was important because it would give her a more of a pleasant stay. Okay, so I do agree with those goals. So SS was a highly motivated individual who was aware of her deficits and made sure she was present for all therapy sessions, even if she was during an activity. So when I would go up to her floor to bring her down to the rehab gym, and it was in the middle of a session, I would ask her, do you want to continue here with your activity, or would you like to come down to the rehab gym now, and I could come pick you up later? And she would be like, no, therapy now. And so we would do that. Her family was very involved in her rehabilitation and progress, and it was evident that her family meant a lot to her, and being able to communicate to them was important. Okay, so now over to treatment. Okay, so for short-term goal 1, resident will increase selection accuracy of personally relevant vocabulary and iPad communication system with ProLoco to Go software in 8 out of 10 trials given mild visual and verbal cues. So the client and clinicians created a family page, a food page, and a medical statement page. The family page had images of her family and their names. So like it would be her husband, her children's names, her grandsons, her cousins, all that stuff. And we would ask, and we would practice producing each of her family's names, and also, and then client and clinician created a food page of Guyanese foods that she enjoyed, and we would create statements regarding these foods so she could tell her family members to bring these foods when they came to visit because she still loves Guyanese food. Okay, so short-term goal 2, resident will create messages for staff and family utilizing iPad communication system in order to express medical and social needs to staff and family in 8 out of 10 trials given minimal cues and iPad setup. So according to Bahia and Chun, AAC devices may provide a means of communication through technology when individual spoken communication skills are not functional. So treatment entailed working with iPad communication system, ProLoco to Go to create questions to ask family members and staff members. An example would be, so her daughter lives in Guyana, but the son lives here in New York City, and we would create questions like, how was work today, or was work busy, stuff like that. And then the resident engaged in conversational exchange with daughter who lives in Guyana, while using a FaceTime application on the iPad. So she was able to FaceTime with her daughter, and and her grandson was there as well. And we would ask, with the help of a clinician, we would ask the daughter questions about the grandson, like how is he doing? Did he eat today? Or questions about like family members that lived in Guyana and how they were doing. And the third goal, resident will increase use of gestures for a set of 10 words to facilitate word retrieval in 8 out of 10 trials given mild tactile and verbal cues. So group therapy sessions. So she participated in a group therapy of 3 residents all together for a total of 60 minutes. An example of a session is each resident was given what's wrong picture cards and had to describe them to the other residents. So SS used gestures like pointing to her arm for a watch or pointing to her head for a hat when describing what was wrong in the picture. She also used gestures like pointing to the leg or the stomach when talking to medical staff if she felt any kind of discomfort. She really enjoyed group sessions. She loved being around people and socializing with the help of her AAC. So AAC facilitate communications and interactions with each other and reduce guesswork and failed attempts to talk. Since